Now make sure your baby is laying on a firm mattress and that you do not use any pillows or teddy bears or excess blankets to crowd your baby's sleeping space, as these things can increase the risk of suffocation. Moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and as you can tell by the title, today I'm going to offer general information that parents need to know as they begin to assume the care of their newborn. Now, after your baby is initially born, a practitioner, such as a nurse or a doctor, will do a thorough assessment just to make sure your baby is okay with breathing, color, activity, things of that sort. Once your baby is cleared of though, your baby should be brought back to you so that you can begin the bonding and the feeding process. With feeding your baby, make sure your baby is eating every 2 to 3 hours if you choose to breastfeed, or every 3 to 4 hours if you choose to bottle feed your baby with formula. It is very important to keep in mind that your baby, number one, has a very small stomach. And number two, your baby is on a liquid diet. With a small stomach and a liquid diet, it doesn't take much for baby to become full, and your baby will process that food a lot faster than if it was eating a solid diet. So it's very important for your baby to eat on a regular schedule to make sure that he or she is gaining the right amount of weight and is staying sufficiently hydrated. Make sure that every time your baby eats that you burp him or her to reduce the chances of your baby becoming fussy because gas bubbles form in their very immature or very young digestive tract. Once your baby is born, he or she is now responsible for the clearing out of waste products such as urine and poop. Make sure that your baby is having at least one wet diaper per day old that he or she is. So take, for instance, on the first day your baby is born, that baby should have one wet diaper. By the next day, he or she should have at least 2 wet diapers, and on until you establish a normal peeing cycle of at least 6 to 12 wet diapers a day. Now, when your baby is first born, he or she will have a darkish green, very sticky bowel movement known as meconium. This first poop typically takes about 48 hours for your baby to successfully clear out of their system. And once they clear it out, a breastfed baby would have yellowy mustard type color poop that has some seeds in it. And most breastfed babies will poop with each feeding. So keep an eye out for this. But most formula-fed babies typically have a more smooth texture poop with less seed than a breastfed baby. However, whether breastfed or bottle-fed, your baby should be having at least 3 to 4 bowel movements a day. Now, that is just a generally accepted fact. If your baby is not straining to have a bowel movement or doesn't seem to be having really hard stools, then it's okay for your baby to go anywhere from 2 to 3 days upwards of 4 days without having a bowel movement. If your baby seems to be having a hard time or is straining a lot, or you see the color start to fade from your baby's face, or your baby goes 3 to 4 days without a bowel movement, you need to start asking a doctor or getting some healthcare provider involved to make sure that everything is okay. When baby is first born, the umbilical cord is clamped and then cut. A few hours after the cord is clamped, that pulsating in the stuff that is still attached to your baby will stop, and the umbilical cord will begin to dry out. Make sure you keep a close eye on how well this cord is drying. You can also clean it with alcohol swab and keep it open to air so that it can dry and effectively fall off a few days following birth. If you change your baby's diaper or your baby's napkin, fold it down so that it does not cover the umbilical cord. You want this cord exposed to as much air as possible, which can facilitate the drying process. When baby is first born, he or she also needs to transition from the internal womb environment to the outside open air. Keep in mind that your baby's skin is relatively thin, and babies don't have a lot of subcutaneous fat that they can use to keep themselves warm. They also cannot tell you that they are cold, so it is up to moms and dads to dress your baby effectively to keep him or her warm. The key word here is warm. You do not want to put too many layers of clothing on your baby because that can cause your baby to overheat. You also don't want to dress your baby too lightly because that can cause your baby to lose a lot of warmth and he or she can become chilly chilled very quickly. When you go to dress your baby, just keep in mind that your baby needs maybe one additional layer on top of what is comfortable for you, mom and dad. Make sure you keep the temperature in the room nice and comfortable so that you are not having to overdress or underdress your baby to compensate for this. I have a video on how to properly swaddle your baby, so make sure you go watch that video and learn the important steps and the value that swaddling can add to your baby's health. Many moms and dads also want to know how frequently they should bathe their newborn. Make sure that you are not bathing your baby more than 2 to 3 times a week. Keep in mind that your baby is not out here getting dressed for work and going to do a full day's work at a job or anything of that sort. So too much exposure to frequent baths is not necessary. And the more you bathe your baby, the more you dry out your newborn skin. You want to give your baby's skin some time to adjust itself to the outside environment. It's also important to keep in mind that you are not to submerge your baby in any sort of water until your baby's umbilical cord stump has completely fallen off. Until the fall off process is complete, make sure you just give your baby a sponge bath where you wipe him or her down very well. And then make sure you are also using mild soaps and very mild lotion. Don't use anything with heavy scents, as that can be very irritating to your baby's skin. Moms and dads, it is very important for you to lay your baby down on his or her back when it's time for baby to sleep. Research has shown that babies who sleep in any position other than directly on their back are at increased risk for suffocating and aspirating. For those who don't know what aspiration is, it's when your baby breathes in food into his or her lungs that he or she may throw up as he or she sleeps. Now, make sure your baby is laying on a firm mattress and that you do not use any pillows or teddy bears or excess blankets to crowd your baby's sleeping space, as these things can increase the risk of suffocation. Now, keep in mind that as baby is first born, he or she may have a very disturbed wake-sleep cycle. For instance, most babies are active during the night when mom would like to get some sleep and awake during the day. It is important for you to establish a routine very early in the process, because this will help your baby to kind of fall into the way you want things done and get both of you sleeping on a normal, healthy routine. Make sure you are keeping the room nice and very temperate so that your baby is not restless or dealing with any sort of discomfort which can disturb your baby's sleep. Now, keep in mind that all newborns cry. Babies can cry for various reasons. Baby can cry when he or she is hungry, when he or she is hot, cold, tired, bored. Whatever the cause is, it's going to take you some time to get familiar with why your baby is crying. But promise you that crying is normal. It's not something that you should get frustrated about. Make sure you pay attention to what is causing your baby to cry. And before you know it, you will be a professional at caring for your baby, understanding your baby's needs, and then helping other moms along with the process. If you have learned anything from the content of this video, make sure you go ahead and hit the subscribe button and turn on your notification bell so that you are made aware of every time I upload a video. Make sure you also share this video with your friends and family who can benefit from it, and come along with me as we build this community of learners. If you have any questions or concerns, make sure you put them in the comment section below, and I will either address it directly to you or I'll make a new video, because your concern or your question can be another mom's concern. Until the next time, I wish you success with your parenting, and be blessed.